Hello everyone, myself Dr. Jyotirmay Hegde. I am the lead consultant and head at Department of ENT, Aster Whitefield. The topic which I am going to talk today is very common, and especially it's common in the elderly age group. It is called as giddiness, or in broad terms we also call it as vertigo. That is nothing but spinning sensation. When you have a spinning sensation, you feel that you have lost the ground under your foot. So it's very common. To begin with, I would like to say that it's very common in the elderly age group, but however, having said that, it's also common in children as well as in adults because of nowadays lifestyle management. There are different types of scenario. It may be just a giddiness where maybe just a spinning sensation, or it may be something like a loss of balance, what we call it as imbalance, or maybe just a blackout, which is called as syncope, or it may be a sudden severe imbalance associated with nausea, vomiting, ringing sensation in the ear, which you call it as tinnitus, and associated fullness in the ear, or there may be associated reduced hearing. So basically, when we have this vertigo, the primary important organ for balance is in the ear, that's in the inner ear. So we will have to evaluate whether the inner ear is normal or not. That is what we call it as vertigo evaluation or vestibular assessment. So we have a state-of-the-art vestibular assessment lab dedicated for vertigo management at Aster Whitefield, which will let us know in clear whether this vertigo which is happening is because of the inner ear issue, or there are some other issues which may be because of the blood pressure or the cardiac issues or the brain related thing which may be mimicking like vertigo. So the most important thing is the spinning sensation. Associated, there may be nausea, vomiting, reduced hearing, depending on the organ which is involved. So to know what is involved, we do something called as vertigo assessment test. We do the audiological evaluation, we do the hearing test. For some specific things like Meniere's disease, we need some advanced hearing test like electrocochleography, is VEMP, called vestibular myogenic potentials. And these help us to know as to what is the exact pathology. Again, the management depends on what is the area involved. If it is something like about BPP, which is very common, it requires just a positional maneuvering and we can correct it. If it is something like conditions, there are many medical management available. With the medicines and the exercises, we can correct it. Some cases like Meniere's disease, wherein it may not respond well to medications, we may have to go in for surgery. So in short, it all depends whether it's a exercise or a medical management or surgery, depends on the condition which is involved. And to know the condition, you need to do the proper evaluation, which is both a proper clinical evaluation as well as investigations, which are both available. And if you have any further queries regarding vertigo, kindly feel free to ask us or consult us at Department of ENT at Aster Whitefield. Thank you.